Today we're continuing our hip series. We're going to touch a little bit on femoral acetabular impingement syndrome. I'm going to show you a little trick that I like to do in my office to accurately diagnose it. Really important that we nail this diagnosis down so we can do the right treatment for the patient. Typically we like to see this, or this is more prevalent in dancers, gymnasts, anybody that does a lot of high kicking, that type of action. So one little trick that I like to do in the office is just look at the tracking, the passive tracking of the hip joint, okay? There is an orthopedic test to test for impingement, but I really just like to do a passive test. I take the leg and I just make sure it's just nice and loose, just completely relaxed. And as I just kind of push it in a passive way into flexion, this is normal. You can see how the knee is tracking just straight up to the ipsilateral shoulder. That would be considered a normal test. When somebody has impingement, this motion is going to be painful. So what they're going to do is their cheats to get away from it is you're going to see that knee drop to the outside as they come up. So as you're checking this person passively, when they get to about that 90 degree, they're going to start externally rotating and abducting that hip, and that's going to feel better to them. If you try to force it, internal rotation and adduction, it's going to be painful. So just as a passive test, just looking for that drop out is a great way to kind of get an indication that maybe we have an FAI. You're going to look at the pictures that we have attached to this video, and that'll show you some diagrams of the 3 different types of FAI and also some x-rays.